Hi, Dr. Peter Shortland and everyone who may be watching. My IoT presentation today is part of the sensory system on phantom limb pain. The main area I will be focusing on throughout this presentation will be the difference between congenital limb deficiency and adult traumatic phantom limb pain individuals. It is important to understand the differences between pain and sensations experienced by those with phantom limbs and how they may differ between adults and children. Phantom limb is a very mysterious yet intriguing feedback reaction of the body. The result of the phantom limb is usually experienced differently, depending on the type of phantom limb, the age group of the individual, and the age of which the individual gained their phantom limb. Firstly, what is a phantom limb? Well, a phantom limb is a type of sensation one can get after having their limbs amputated or missing. This type of sensation is that the amputated or missing limb is still attached to the body and is moving with relation to other body parts. In short, a phantom limb can be described as a ghostly replica of a lost limb. There are a number of different types of phenomena that can associate with the phantom limb. 1. Phantom limb pain. 2. Phantom sensations. 3. Stump pain. And 4. Superadded phantom sensation. Phantom limb pain can be defined when an individual experiences pain in an area a limb has been amputated or not physically part of the body. Phantom sensation is the feeling one gets within the area which no longer contains an attached limb. This type of phenomena is not painful, but opposingly non-painful. A stump pain is pain only situated in the area of the stump. Individuals with this particular type of pain does not feel the presence of a phantom limb. This type of stump pain would involve the burning, throbbing, or shooting sensation within the residual areas of the limb. Superadded phantom sensation, interestingly, is the feeling of not only a phantom limb, but the feeling of having an object attached or touching the limb. By this I mean to say that the phantom limb, for example, feels as though one is wearing a long sleeve shirt, where the sleeves brush against the phantom limb. Phantom limbs in children are known to differ from phantom limbs in adults. They differ due to the idea that they are usually obtained differently. Children are able to obtain a phantom limb after being born with congenital limb deficiency or having an early childhood amputation. Although children are able to have a phantom limb, not all kids are heard to have them. It has been found across a number of different researchers that roughly 20% of children who are born with congenital limb deficiency develop a phantom limb. Children with early childhood amputations, on the other hand, are researched to develop a phantom limb within roughly 50% of those children. Between the two types of phantom limbs in children, there are a number of different responses. Congenital limb deficiency phantom limbs are reported to be less painful if any pain is even triggered. Early childhood phantom limbs, on the other hand, are painful, tense, and doesn't move. Sensation of the phantom limb is also experienced differently. Congenital limb deficient phantom limbs usually feel the sensations of pain of a phantom limb for hours with a longer onset, where early amputations have sensations of pain lasting for a matter of minutes with a quick onset. There is noted to be no significant difference in age between the two groups of phantom limbs. World War I and World War II, Vietnam and Israeli War are major factors which are known to contribute towards developing phantom limbs within individuals. Landmine explosions cause phantom limbs within healthy individuals, where roughly 90% of amputees of these experience phantom limb pain. Traumatic events like war and landmine explosions are not the only major reasons for amputations of causing phantom limbs. Peripheral vascular disease or neoplasms are also known for major reasons for amputations within adults. Unlike those who are born with congenital limb deficiency, where only 20% develop phantom limbs, it is known that every amputee develops a phantom limb within these adult amputees. After amputation, pain is developed within the first 75% of adult patients. If not, it may take from a couple of months to years to develop, but it will eventually develop. Phantom limb pain has been reported across a number of different researchers that they tend to start due to the patients experiencing a sense of worry, fear, stress, or anxiety. In comparison to both phantom limbs in children and phantom limbs in adults, limbs in young children are relatively reduced. This suggests a number of things about phantom limbs and its relation to the brain. Within the first 8 years of life within the developing brain, body image neuromatrix is formed. It also suggests that although there are those that are born without limbs, they too may experience phantom limbs due to an understandable neuromatrix rewire done to the brain. Interestingly, phantom limbs have been linked to one's thought, thus it can be felt by the mere thought of it. This is a major reason why adults indicating they have a phantom limb is hard to believe in some cases. It is also known to become more salient if the phantom limb is specifically attended to or when it is active. Ronald Melzack is a professor who developed the leading hypothesis which believes that although phantoms lie within the brain, it is not located in a single area of the brain, of which is known as the somatosensory system, but it is also believed to involve the cerebrum itself. For Melzack's theory, there is a map within our brains, where a virtual body is mapped out, as this image within this slide shows here. Phantom limb experience is majorly known to be caused with the reaction between emotional systems and motivational systems within the brain. Experience of the body is not derived from any straight line information pathway that is fed by sensory receptors. Phantom limbs are caused by conflict between proprioceptive and visual inputs within the brain. So in conclusion, to everything, adults and children are known to have different perceptual references in their phantom limbs. This seems to deal particularly with the way that the brain is able to remap itself or the way the brain is pre-wired at birth. Adults with a lost limb from amputation may find that their phantom limb is located somewhere else. It should not be located, thus on the shoulder or amongst the face. This concept is known to be true as an amputation can be a shock to the body and thus new neuron links are created across the empty spatial area of the brain which once contained the mapping of the lost limb. Children who are born with missing limbs have a lower chance in brain remapping, as their brains are already pre-wired at birth due to genes. Children born without a limb tend to not feel pain within their phantom limb, as their brain would see it as normal. An adult's brain, however, receives visual input daily that these limbs exist and continue to exist. Thus, the pain increases. Thank you.